Hello everyone and welcome. I'm Pei-Chang Liu, the ICU physician for Guam Regional Medical City. Today we're delving into something absolutely critical in ICU, interprofessional collaboration for ECMO management. The ECMO stands for extracorporeal membrane oxygenation. If you work in medicine, especially in critical care, you probably know about ECMO. It is a powerful machine that can save lives. But for it to work well, doctors, nurses, and the respiratory therapists, the so-called RTs, all need to work together smoothly. When they do, patients have a better chance of surviving. Right now, though, there are serious gaps in knowledge. These are not small mistakes. There are big problems in understanding each team member's roles, how the ECMO system works, and how to talk clearly during emergencies. These gaps can lead to worse care for patients, slow things down, and increase the risk for patient complications. That's why we have created a 1-hour workshop to help close these important knowledge gaps and give your team the skills to use ECMO safely and confidently. Our goal is real improvement. We're aiming to cut complications by 30% within 6 months of the training. What makes this workshop different is that it brings respiratory therapists, nurses, and doctors together for hands-on practice, not just sitting in the same room, but actually learning and working side by side. The focus is on building a shared understanding and clear, consistent ways of working. By training together in a realistic setting, your team will learn how to function as one unit. This kind of teamwork is what makes ECMO a reliable, life-saving option in your ICU. Everyone will know their role and how it fits into the bigger picture. Our big goal here is simple. We want everyone in the ICU team, doctors, nurses, and RTs, to feel confident and capable when managing ECMO. This is not just about knowing your own role. It is about working together in a way that is smooth, safe, and effective. When we do that, we give our patients the best chance at a good outcome. To get there, we're going to focus on 3 key areas. First, role clarity. Everyone needs to know exactly what their responsibilities are and how they fit into the bigger ECMO plan. When you are in critical moment, you do not want any confusion. Clear roles means faster and better decisions. Second, technical skills. You will build the hands-on skills to run the ECMO circuit, fix problems when they happen, and understanding what's going on inside the patient's body. This part is about getting comfortable with the equipment and the science behind it. And third, communication. Good teamwork depends on clear, direct communication. We will work on how to talk to each other quickly, clearly, and with a purpose, so nothing gets lost in translation when seconds matter. By the end of this hands-on workshop, here's what you'll be able to do. First, understand ECMO and know your role. You have a solid grasp of the basics, when ECMO should and should not be used, and you clearly understand what your specific role involves. For example, RTs will know how to manage sweep gas, and nurses will know how to do thorough circuit checks. Second, build real ECMO skills in practice. You'll get to work in a realistic, hands-on environment where you will learn how to set up an ECMO circuit correctly, fix common problems, and adjust the ventilator and ECMO settings to best support the patient. Third, work as a team during emergencies. You will practice handling ECMO emergency as part of the team. We will focus on a strong, clear communication, like using closed-loop communication and sticking to set procedures so your team can respond quickly, safely, and effectively when it matters most. Our 1-hour workshop is designed for maximal impact and hands-on learning. We kick things off with a 15-minute interactive mini lecture that covers ECMO essentials and emphasizes clear role definitions. To make it engaging, we use who does what flowchart as a visual guide and some MCQs to challenge assumption and spark discussion around role boundaries. Then comes the heart of the workshop, a 30-minute immersive simulation. Picture this. You're in a hypoxic crisis scenario. The patient's oxygen saturation suddenly drops due to oxygenator failure and ventilator desynchrony. This is where each role steps in. RTs check the sweep gas, ventilator settings. The nurses will inspect the circuit for clots, and physicians assess for recirculation issues. The simulation is interactive. Our managing only improves when the team takes correct steps together. Communication is critical here, with closed-loop language like RT increasing sweep to 3 liters per minute. Can you confirm this? We then wrap up with a 15-minute debrief, arguably the most important part. Here, we highlight what went well, like clear communication, and examine any role confusion or overlap. Most importantly, we discuss how to take what we have learned and apply it to real-life ECMO cases. To make it engaging, we even do sticky note voting so participants can choose the top teamwork barrier they experienced during the exercise. To make sure the training sticks, we have built a solid plan to assess learning and improvement. Right after the workshop, we do a quick 15-minute quiz with questions tailored to each role. So RTs, nurses, and doctors each get questions to match their responsibilities. We also check how teams perform during simulation. They will need to correctly set up an ECMO circuit in under 10 minutes with no major mistakes, and handle 3 common ECMO emergencies in 15 minutes without any dangerous errors. We then follow up to make sure the lessons last. 1 week later, we run surprise in-hospital simulations, like responding to a circuit alarm during morning rounds. We also ask participants to rate their teammates anonymously on things like accountability, flexibility, and communication. Plus, everyone writes a short reflection 24 hours after the workshop, thinking through what they learned and how working with other roles changed their approach. In the long run, we will track real patient outcomes by looking at ECMO complication rates in the ICU, things like circuit problems and cannulation errors over the next 6 months. The bottom line is to improve patient care during critical moments, and we're using real data to make sure that happens after this ECMO training. This team-based training really matters. When we give healthcare teams clear roles, strong technical skills, and great communication capabilities, ECMO becomes a dependable and life-saving tool in the ICU. If you would like to learn more about this training or how to bring something like it to your own hospital, feel free to reach out to me. Thanks for watching. We're excited to see how this training can make a real difference.